Trauma. It's something that you could have been living with for a very long time, even if something happened many, many years ago and it's lying there unresolved. And today I'm going to give you signs that you are still living with the effects of this trauma, so you can hopefully find the help that you need to overcome it. Stay tuned to the rest of this video. Trauma is something that can have a very long-lasting effect on our lives. It's something that can be an individual event that has shaped us and affected the rest of our life, or it can be something that has happened consistently over a period of time and is having a very detrimental effect on us, and we may not even realize it. A lot of times we try to have the stiff upper lip and just keep going through life and thinking I'm going to be okay and everything is fine. And we may not even realize that we are actually suffering from underlying trauma that is heavily impacting our day-to-day lives. And everything is so closely linked that it's important to pick things apart and find exactly what symptoms you are suffering from that are related directly to the trauma, so you can come to better understanding of how you can overcome them and lead a happier and healthier life overall. So it's very important that we identify these symptoms so we can treat them. Now, the effects of trauma can present themselves in 3 different ways. They are cognitive, physical, or behavioral. And like I said before, all of these things are very much interlinked towards each other. So because it's such a wide topic, I'm going to break down each one individually, and today I'm going to be focusing on cognitive symptoms that you are suffering from underlying trauma that has not been healed. Cognitive signs are something that we tend to dismiss the most because it's something that we feel doesn't need to be addressed. It's something that we try and push ourselves through daily, and we tend to try and ignore as much as possible. It's not like that janky knee where you have pain every time you walk, so you think, oh, you know what, maybe I need to go to the doctor and get my knee checked out before I do further damage to it. Because it's not a physical pain, a lot of times we tend to ignore it. And it's something that we very much need to address, because cognitive symptoms of trauma are something that can seep its way into other things, such as behavioral and physical symptoms. In fact, I would even go as far as to say that cognitive symptoms are what trigger your behavioral and physical symptoms. And if you can get your cognitive symptoms under control, then your physical, behavioral symptoms often more times than not can sort themselves out to a great degree. So there are many cognitive signs that you are suffering from underlying trauma that has not been healed. However, today I'm going to focus on 3 main ones, and these will tie in very closely to everything else. So the first one of these cognitive signs is having horribly intrusive thoughts or images that you have no control over. And I mean not have any control over is, say for example that you have gone through something very traumatic in your life. It could be a single event. Oftentimes it is a single event. It could be a recurring event. Either way, you are not sitting there trying to think about this event. You're trying to get on with your day. You're trying to get on with your life. However, you are having intrusive thoughts. You are having thoughts that you have no control over coming into your mind that are reminding you, that are horrible, that are linked to the trauma. So say for example, you were violently beaten by somebody, but maybe you're in an everyday situation and somebody stands too close to you. Say you're on a bus or in public transport, somebody stands too close to you, and all of a sudden this thought comes into your mind, oh my god, they're trying to hurt me, oh my god, they're standing too close to me. Or maybe you have a flashback of the event that caused you the trauma. Now, it's not like you're trying to recall these events, it's just that these images or these thoughts are popping into your mind and you don't want them there. You don't want to think about these things. Unfortunately, it's beyond your control. It's just something that's happening whether you want it to or not. So it could be that something's triggered this intrusive thought. Like I said before, maybe you've gone through violence and somebody is standing too close to you. Or it could be that you're just doing something very regular like shopping, and all of a sudden you just get this thought of somebody hitting you or somebody being behind you, an image of somebody getting beaten or somebody beating somebody helpless. And it's not something that you can control. In fact, it's something that brings you a lot of distress. However, you have no control over it. And these thoughts that are intrusive are definitely not your fault. It's actually a result of the trauma that you have gone through that is residual. It's still there and it's presenting itself into your everyday life. And oftentimes, a lot of people who have these intrusive thoughts will often become very upset and distressed because they think that maybe they are a bad person and they are having these thoughts because they are a bad person, and that's absolutely not the case. The reason that this is happening is because it's something that's completely out of your control. It's not coming from a place of desire or want. In fact, it's coming from a place of fear. It's coming from a place of trauma. It's coming from a place of hurt. Intrusive thoughts are never ever the fault of the person who is having them. And I think that's something that's very important for you to remember if this is something that you have happened to you. I've even spoken to people who have said that triggers such as even somebody's smell or a particular color can trigger trauma that they've had in the past. I myself went through an episode when I was very, very young, around 6 years old, where I was very much afraid of something. I had something that caused me a lot of fear. And the person who scared me was wearing particular colors at the time. And I still remember these colors quite vividly. And for years after this one single event where I was very much scared, every time I would see these colors, in particular white and red as a combination, or even yellow, I would get triggered and I would have these intrusive thoughts and I would become very distressed. So it's important that you realize it's absolutely not your fault and it's something that is completely beyond your control. Therefore, it's important that we recognize this as a symptom of untreated trauma and get the adequate help that we need to overcome it, instead of feeling like it's something that we can control or it's something that is our fault. Now, the second thing I would like to talk to you about today is very closely linked. And like I said before, everything I'm going to talk about is very much interlinked with one another. Everything seeps into one another. And when you have these intrusive thoughts that cause you a lot of distress, your body can go into extreme stress mode. And when we go into stress mode, one thing that definitely will affect us is insomnia. Now, I'm sure nearly everybody has heard of insomnia, but you probably don't know why it's happening to you. Well, if you've had a traumatic experience in your past, then this insomnia can be a symptom of this trauma that's presenting itself in your life. And like I said before, it's very important that we recognize these symptoms so we can treat them properly. Now, this traumatic event and even having these intrusive thoughts is going to put your body under an extreme amount of stress. And this stress response is going to make you more alert than normal. It's kind of like your body goes into fight or flight mode and it just cannot switch off because it's constantly on edge. So you may desperately want to fall asleep. In fact, you may be incredibly tired physically and mentally, and sleep is exactly what you're looking for. However, you are very much struggling to fall asleep. Every time you lay your head on the pillow, you can spend hours tossing and turning and you're not anywhere near sleep. Or if you do manage to get a little bit of sleep, then you will wake up shortly after. So maybe you've only had like 20 minutes, 15 minutes, half an hour of sleep and you just wake up. And that's because your body is in fight or flight mode. So that stress response is going to make you more alert than normal and you're just going to wake up again. And now you're probably thinking, well, I'm not trying to recall the trauma. I'm not trying to recall the events that gave me the trauma. So why is this happening? And it's not, like I said before, something that you have any control over. You may be desperate to fall asleep. However, your mind is unable to completely relax itself due to the stress response that you're feeling because of the intrusive thoughts, because of the unhealed trauma that you've had in the past. Even if you're not actively thinking about past events, that the residue from the trauma is seeping its way forward, and that's what's causing the stress, and that's what's not allowing you to fully relax and fall asleep. Now, there are different stages of sleep, and REM sleep is one of the most important stages. REM stands for rapid eye movement, and it's usually one of the deepest stages of sleep, and it's very, very important for us because in the REM stage is where we process our memories and where we can process our emotions more effectively. And if you're not getting that REM sleep, it's definitely going to affect your memory, it's definitely going to affect your emotions, and it's something that people who have underlying trauma that they haven't resolved struggle with the most. You're going to really struggle to get into a deep sleep and actually stay there. And even if you do manage to drift off into REM sleep, then you will suddenly either jerk awake, or like I said, you will get a very short amount of sleep, not enough to fully heal yourself, to heal the body and mind, and then you'll wake up again, usually feeling even more tired than before you went to sleep. Now, if you do manage to get into REM sleep or into any kind of sleep, another factor that heavily causes cognitive symptoms due to underlying trauma that hasn't been healed is nightmares. You're more likely to have dreams that are going to leave you feeling anxious, that are going to affect your mood negatively after you wake up. They're going to have, like I said before, it's going to seep in and you're going to wake up, and if you had a nightmare, it kind of affects the rest of your day. A lot of times people who have gone through trauma don't necessarily relive that exact trauma in their sleep, in terms of, say for example, my earlier example, if you've been beaten or you've suffered some kind of violence, it's not necessary that you're going to suffer that exact same violence in your mind. It could be that your mind is finding other ways of showing you that you are under stress, and that could be in the form of getting dreams often where you're being chased by something scary, where you're unable to escape. And these are all ways of your mind telling you that you are incredibly stressed and you have underlying trauma that you need to heal. And a lot of times, like I said before, when you wake up, you're going to have these residual feelings of being anxious because you've had these nightmares, and it kind of affects the rest of your day. If you've ever had a dream before, whether it be good or bad, I'm sure that if you've had a good dream, you wake up feeling great. It impacts your mood and it makes you feel better throughout the day. Whereas if you've had a bad dream, it can really affect, depending on what you've seen in your dream, the rest of your day. And this again pulls you into a nasty cycle that I was talking about before. Because you're having bad dreams, it's making you feel worse, and it may make you even more anxious about falling asleep, which again gives you the insomnia, which again causes all of the other symptoms. So it's a never-ending cycle unless you get treatment to address the underlying cause of this, which is the unaddressed trauma that you've gone through. Now, the last thing I want to talk about today is something that I've mentioned throughout this video and is very closely linked to everything else, and that's anxiety. Anxiety is something that everybody suffers from time to time, but if you have underlying trauma that has not been healed, then it's going to be something that is a constant part of your life. Like I said before, when you've gone through trauma, either reoccurring or as a singular event, then your body is going to be in stress mode, in that fight or flight mode. And your body's going to be trying to protect itself, and it's going to think, well, maybe this can happen again, maybe the traumatic events can happen again, I need to be more cautious. And that constant stress mode is going to make you very, very anxious. And this is particularly prevalent when you are in a situation where you are dealing with trauma on a regular basis. And I have to emphasize here, a lot of times we do not think that what we are going through is traumatic, but in fact it very much is, and it's having a massive impact on our lives without us even realizing it. And I'm going to use the example of domestic violence because it's something that happens often to one particular person or a group of people, usually perpetuated by another person, the spouse or the partner. Your anxiety is going to be through the roof when you're living with somebody who can flip at a switch, who has either hurt you very much emotionally, physically in the past, because you're going to be constantly thinking, oh, I don't want to do anything to make them hurt me again. I don't want to do anything to trigger that response from them again. So you're constantly living in an anxious state. And I want you to recognize that what you are going through is trauma. It's actually traumatic for you and your body, and it's something that you actually need to heal. And just from my experience in working with and talking to people who have suffered with domestic violence, I can tell you that it gets to a point of you are being so anxious that it gives you panic attacks. It can give you increased heart rate. It can increase your chances of heart disease. It can increase your blood pressure. It can increase significantly your chances of having a stroke. Therefore, it's very, very important that we not only address the trauma that we've been through and the underlying reasons for that trauma, but that we seek out the help so we can heal from these things. And it's important that we get professional therapy and that we speak to a professional that can help you to heal from these, so you can actually have a much better quality of life. And like I said before, it's not something that's in your control, it's not something that's your fault, but it's definitely something that you should seek help for. And I will be offering a talk therapy service in the future, so stay tuned and I will give you more details about that in the future. But for now, thank you so much for watching this video. I will be making further videos on the other 2 points that I've talked about, which are the physical and behavioral symptoms that come from underlying trauma that has not been healed. So stay tuned for those, and I hope you have an amazing day, and thank you so much for watching. And if you like this video, then please remember to like and subscribe to the Mind Counsel channel so you can keep up to date with any new videos that I post. Thank you so much.